And Mr President, I only got an email this morning from a person from Circular Head who was expressing real concern about the mental health challenges of people in the dairy industry in that area. So I think it certainly has application, and I'll be passing it on to them to maybe assist them as well. So Mr President, we all know that mental illness is common in Australia, and Tasmania is no exception. The Tasmanian resources industry is cognisant of the growing recognition of the important role that employers and industry can play by working together in addressing this important health issue. This understanding has been the key driver in the development of this blueprint. Mr President, we also know, as is stated in the introduction of the blueprint, regional Tasmania is beset with high rates of unemployment, low rates of educational participation beyond Year 10 and a struggling health system. When coupled with the rugged and remote working conditions incumbent with resource exploration, mining and downstream production, the impact on individuals, families and communities looms as a constant issue. Mental illness impacts workplace productivity through absenteeism and presenteeism and flows on directly to impact families. If mental health problems are left unaddressed, they can also have an effect on rates of accidental injury in the workplace. Mr President, these are the realities for all workplaces, and as I have noted, this blueprint and its application are not limited to the mining and energy sector. I am confident that all workplaces value the mental health and wellbeing of their employees, just as members of the Tasmanian resources and processing sector do. This sector is unequivocally committed to the health and safety of their workplace and workforce, acknowledging that Tasmanian resources and processing sector have maintained a vigilant focus on workplace health and safety and have historically directed their efforts toward the identification and mitigation of safety risks and physical harm to individuals in their workplace. And I note from the blueprint, and I quote, "Over the past few years there has been a widening of this focus to include the wellbeing and mental health of those working in our industry. There is now a strong body of evidence that attention to mental health in industry can bring sustainable benefits. Workplace mental health programs have direct benefits in reducing absenteeism and improving productivity and workplace injury claims, alongside indirect benefits to recruitment, retention and staff wellbeing. Programs that address mental health in the workplace can also bring social benefits to the morale and culture of a workplace, to employees and their families. The wider impact of mental health programs in the workplace should not be underestimated. These pathways contribute to the impact on individual health, wellbeing and functioning, and contribute to the delivery of broader health benefits to the community." So Mr President, the Tasmanian Minerals and Energy Council blueprint has been developed to guide industry response to addressing mental health. This blueprint has been built on previous work initiated by the New South Wales Minerals Council and conducted in collaboration with the University of Newcastle's Institute for Energy and Resources and the Hunter Institute of Mental Health. It was developed in consultation with industry and health service leaders and informed by leading research being undertaken in this field. Mr President, I commend the work of all those involved, the health and safety officers around the minerals and energy sector throughout Tasmania who have given many voluntary hours to this. I also commend their employers for enabling the time and resources for their employees to participate. This enormous amount of work has gone into this document, and it's a really well put together document. Mr President, this is a document that will be useful for all workplaces. It's available online as well as in this hard copy form. And I thank the TMEC and for their ongoing commitment to the health and wellbeing, physical and mental, of their workplace and the benefit this approach brings to their families and workplaces that they're responsible for. I commend the document to all of you.
The Honourable Leader.
Mr President, I move that the sitting be suspended to the ringing of the division bell.